Psychetruth. Life, wisdom.
Hey everybody, this is Dr. Jeff Echols. Welcome back. Thank you for joining us today. This is the second video in a series that I'm planning on doing to help to show you how we approach lower back problems in a systematic way, I should say, so that we make sure that we get everything corrected properly so these problems don't keep returning over and over again. And in the last video, we found out that Miss Corrina had a weak psoas muscle, which is the muscle that's right here, and it helps to flex the hip and helps you to bend over. This is a huge muscle, very, very important, and it can be extremely painful when the person has that go out on them. It can pull them over, lean them over to the side, bend them over. It can put you on the floor. I can personally attest that I've had this happen to me. It is not fun. So this is something that we can really help with. Now in her case, we tested the muscle. It was very weak. She could not hold the muscle up. We did some different kinds of treatment on it, including an adjustment in her lower spine that turned the muscle right back on, and now she's strong. So now we're going to take you to the next step, which makes sure that she doesn't have any disc problems. Now, for those of you who don't know what a disc is, in the spine, you've got 5 lumbar vertebrae, or 5 vertebrae here in the lower portion of the back. In between each of those vertebrae is kind of like a cartilage wedge, and it has some juicy stuff in the middle there. And sometimes those discs can herniate or bulge out, and they can put pressure on the nerve. And normally that's going to cause problems that radiate down into the leg. And normally, if it's a disc problem, it will go all the way down to the foot. If it doesn't go all the way down to the foot, it may not be a disc problem. It may be a problem just in the sacroiliac joint or some other pelvic anomaly. So the next step is that we want to just absolutely make sure that she doesn't have any disc problems. So we're going to do an orthopedic test to help us determine that. And then I'm going to test the muscles that correspond to the nerve roots where that disc is. Okay? So I'll show you how we do that. Go ahead and lay down on your back. Now, this is a straight leg raise test, and this is very important. I don't anticipate this being abnormal with you, but it's just something that we do as a safety precaution, or lets us know that we are dealing with a herniated disc. So we just raise this leg up like this. Corrina is very flexible, and my goodness, is she? I wish I could do that, guys. I really do. But there's no problem when we do that. If she had a disc problem, picture that she has the spinal cord's going down here, the nerve is coming out from the spine, and that disc is bulging on it, or it's very close. When I do this, it kind of pulls on the nerve root a little bit. It pulls on it, and it hits that disc, and you would say, oh, right there. I can't, don't raise my leg any further than this. This is a positive straight leg test. And we can even further accentuate it sometimes by pulling the foot back. And then you go, oh, now it really hurts, okay? So this is called a straight leg test, and we would do this on both sides because she's got nerve roots that come out on both sides of her leg. And this leg, oh, you're showing off now. I wish I could do that. All right, that leg is very good too. So we know that the straight leg is not positive, so that's good. But we want to go ahead and further test the muscles, because if that nerve root has a disc pressure on it, it's going to shut this muscle off. It's just not going to work properly. So in order to test the L3 disc, and that corresponds to, which is the third lumbar vertebra here, we're going to check a couple of muscles. And one is the Tensor Fascia lata. And let's see if we can do this right here. Push your leg straight out for me. And that muscle's pretty strong. Push this muscle straight out, and that muscle's pretty strong. Now, let's go ahead and raise this, push up here. Good. That stayed strong. And push up here, and those are strong. So oftentimes when we get a person with a disc lesion and it's putting pressure on that, by testing those specific muscles, it tells us where the disc problem is. So we know it's not that. There's a couple of other muscles that we would check that would be corresponding to the disc problems. This is the anterior tibialis. You'll just leave your foot on the table. And what you're going to do is don't let me push your foot down. Bring it up like this. Don't let me push it down. And that's a really strong muscle because we use it to walk. It keeps you from falling over. And that's a real strong muscle. And even though it's a little foot, I can't push that muscle down at all. So that's the anterior tibialis. And then we would check, everybody knows about the gastroc muscle right here. This is your calf muscle. And to test this muscle properly, you need to point your toe down and then pull your heel to your bottom. Okay, and pull. And that's locking real nicely. A lot of difference, huh? Now, bring this leg up and pull right here. Very good. Okay. So what we've done is we've determined through the straight leg test and the fact that all of these muscles are intact that she does not have a disc problem. So does that, yes, yay, yay, nice. But we don't know whether she has any pelvic distortion or whether she has any problems in the lower back, whether they're, misaligned or whatever. So we've gone ahead, we fixed the psoas muscle, and that was in the first video that we did. Then we went in and checked to see if she had any disc problems. We did that by doing a straight leg raise, no nerve root tension, she's fine there. Then we went and checked the individual muscles that correspond to the individual discs and made sure that they were strong. Believe me, if you've got a disc problem and you're putting pressure on that nerve root, you will not be able to have a strong muscle there. So the next thing that we're going to do, now we look at the pelvis, and we break this up into different categories. This is the first one. It's called category 3. I don't know why it's not category 1, but they start with category 3, and we go 3, 2, 1. So to check to see if she has a category 3 pelvis, and basically what that is it means that the pelvis and the lumbar vertebra are feel like they're disconnected from one another. They're not functioning well as a unit together. So there's a specific way we test for it, and I'll show you how we do that. Now, we're going to use the hamstring muscle to test, and first thing we'll do is just make sure that it's strong. Push against my hand. I cannot budge it. Very good. The next thing we're going to do is I'm going to take my thumb and I'm going to put it right on the L5 vertebra, the little spinous process that sticks up. That's what you feel as you go down through the back. It's called the spinous process. It's the little bone that sticks out. I'm going to put my hand there, and then I'm going to put my other thumb on the sacrum, and we're going to push in opposite directions like that. And now push. Still nice and strong. That's good. And now we're going to go the opposite direction. So I'll put my thumb over here on L5 and push the opposite way on the sacrum. Retest, push, and it's still real strong. So Corrina is fortunate. She does not have a category 3 pelvis, which means that her hips and her lower back are kind of talking to one another and know what they're doing. So the next thing is we're going to move to a category 2 pelvis. And keep in mind that by approaching lower back problems in this systematic fashion, we're going to make sure that we don't miss anything. We're going to make sure that you don't keep ending up back in the doctor's office, every few weeks. We're going to make sure that this works. So I want you to go ahead, Corrina, just lay on your back for me, and we'll show you how we check for the next stage of this process, which is called a category 2 pelvis. And to do that, we're going to check what we call the Sartorius muscle. And this is a muscle, it's kind of a long, thin muscle, and it comes from up here. It wraps around your leg like that, and it hooks right here. And I still remember in school, they call that the pes censorinus, which means the foot of the duck. I guess it actually looks like that when you're, dissecting people and you're looking at the muscle, I guess. It's amazing when you're going through school. They have a name for every single thing there is. It's just amazing. I can hardly remember any of them. So to test this muscle, we're going to bend your leg like this, and I'm going to have you pull your heel in toward your bottom. So go ahead and pull. And that doesn't work very well, does it? You want to try again? Pull your leg. It just won't lock. So I'm going to come around to this side and we're just going to check this one as well, just to make sure. Put your leg down, pull here for me. Now that one stays nice and locked there. So that's good. So, we have what we call a category 2 pelvis. What does that mean? Well, I'll tell you what it means. It means that her pelvis, if you think about her pelvis bones like this, one of them is rocked backwards. Okay, it's rocked backwards. That's category 2 pelvis. When that happens, it shuts this muscle off, and it also creates a lot of distortion in the pelvis, which eventually will go up into the back and end up causing problems up there. So what we have got to do is to figure out a way that we can know why your body has put your pelvis into this position. You know, and it can be because of problems anywhere in her body. She could have a problem up in her neck, and in her shoulder, and in her knee, and in her gallbladder. It could be anywhere. And her body is adapted in such a way that it's put her pelvis there so that she can function. Okay? So if we just tried to adjust her hip back, the body would say, hey, I had that hip where I needed it in order to function properly, and you've just put it there, so I'm going to put it right back. And that's why people oftentimes, you know, go back to the chiropractor every single week for the same exact problem, just so that they can get by. But if you know how to do this properly, we can go ahead and start unwinding things, fix the neck, fix the shoulder, fix the knee, fix the gallbladder, whatever it is that needs to be fixed, so that then when it's time to adjust the pelvis, the body goes, hey, now I don't really need that pelvis in this distorted position, and we can keep it level. And then you're going to be in a lot better position. Because once we get all adapted and we've got all these things adaptations, we don't have anywhere else to go, and then finally the body just breaks down. So in order to do this properly, normally it takes anywhere from 5 to maybe 20 visits to unravel all of the different problems so that when we can adjust the pelvis, normally 5 to 6 visits. But sometimes if there's a lot of trauma or a lot of problems, or the person's quite a bit older, it can actually take a little bit longer to do that. But the idea is that we're kind of undoing these issues in the body so that when we do adjust the pelvis, it's going to stay put. Okay, so what we've done is we found that she has what we call a category 2 pelvis, which means it's rotated this way. So we need some way to kind of hold the pelvis into the right position while we look around the body and see if we can find other problems. Now, being the forgetful person I am, I did not bring my blocks with me today. And blocks are little padded things that I can use to wedge under the pelvis to keep it in the proper position. But we're going to use these towels today as just kind of a makeshift way to do it. And we actually just checked it off camera and it seems to work fine. So since this hip has actually rocked, and if you'll picture this hip is rocked backwards this way, we're going to put the wedge under so it'll hold the pelvis back up this way. So if you will just lay it, there we go. And that's putting that up. And then this one, we're going to put under here like this to rock the pelvis back this way because it's going anterior. So now I've got the pelvis blocked, and when we go back to check the muscle now, it should be strong. Pull. And it is. She's holding that quite nicely now. So now that we've got the pelvis blocked, we want to start asking the body, where are all these other problems that you have that are keeping your pelvis this way? Okay. So we'll just go back to this. And she's got some muscles that are giving us trouble. And there's one right there. And there is neurolymphatic. So is it going to be tender there? Yeah. Okay. So it shows there. And is it tender here?
Yeah.
Yeah.
Oh,
okay.
Yeah. Oh my God.
Oh my God.
Ooh.
So the body's already directed us to one of the problems that she has, and it's with this muscle over here that goes along the side of the leg. It just happens to be called the Tensor Fascia lata muscle. I love saying that. It just sounds so cool. Tensor Fascia lata. Wonderful muscle. And it runs down the side, and a lot of runners sometimes have problems with these muscles. It's also known as the part of the IT band as well. And when I'm touching these points on here, she's very aware of it. It's very uncomfortable, kind of tender anyway. And it's got her attention. And keep in mind that when we first started with Corrina, I asked her if she had any lower back problems. She said no. So again, symptoms are going to be the last thing to show up. You're not going to know until you're having a lot of pain. And oftentimes they, estimate that you got to be about 80% broke before you start having symptoms. That's why, going to the chiropractor somewhat regularly and getting adjusted and keeping your spine in good shape and keeping healthy and eating the right foods and all of that stuff is just so important. And we'll see if that's done. Push here. Okay, there's a little bit more to do on that muscle. Actually, we didn't really hold that point long enough, Corrina. It's still pretty tender there, isn't it?
It's getting better though.
Yeah. It's kind of the neat thing about this system. If, like I said before, if we didn't hold this point long enough, it'll just keep showing up until we do. It really helps us gives us a way to listen to the body and tell it what it's telling us. Corrina doesn't know, but her body knows what's going on. And this method is just a way that we can actually talk to the body through these muscles and have it tell us what's going on and where to go and what to fix. That seems to be pulsing pretty good now. And we're just going to look around and find some other muscles that may be bothering her. Right there. Okay. So she may have some muscles in her lower back that are actually giving her some trouble. So we're going to actually test to see if those muscles are weak real quickly, okay? So I want you to put your legs over to the side, way over here. And I'm going to ask you to not let me pull your legs this way, okay? And they're pretty weak, as everybody can see that. So that's going to be one of the next things that we go ahead and fix. And in order to do that, we're going to put you back onto the blocks. And like I said, normally this can take, in the office setting, this can take several visits, if not more, to actually get everything corrected in here. So it seems as if the quadratus lumborum is there. I haven't memorized all of these points, so I have to look. And it's a good thing we've had people that have gone before me that have done a lot of this work and wrote it all down. Okay, so there. Let's see what we got. Push. Okay, quadratus lumborum, it's going to be good. And then the insertion is going to be there. Okay. Is that where it's tender?
Ooh, oh God.
Right there.
Oh God.
Okay. So, fix you. So what we're doing is we're holding this point up here on her head that corresponds to this muscle. For those of you who are interested in that kind of thing, this muscle is called the quadratus lumborum. And it's actually, we used to call it the fish muscle because if you think about how a fish swims back and forth, that's this muscle right here. And this I'm holding here where it attaches, and it's very, very tender for her. But she really never had it. She didn't really have any back problems, right? All right. So we're just going to hold this until we get some nice pulses in here. And this is the amazing intelligence of the body. showing us and directing us to where we need to do, what we need to do next, by following the system. How's that doing now?
It feels a lot better.
A lot better. Okay, we're going to see if that's got it there. Good. Okay, so there's another spot. It's going to be, is it tender right in here somewhere?
Oh, yeah.
Right there. And then again, insertion. It's going to be right in here. So again, we're just holding these points on the muscles, getting them turned back on again. Okay. Push here. So when we get to this point, she goes weak in this arm. It's what we call yin, going into the yin. And her body's basically said, dude, I've had enough for today. So what we would do is we recheck this muscle real quickly. Push, pull. It's now much, much stronger than it was. However, it probably won't stay that way until we get everything else cleared out. But her body's saying, look, we've had enough for today. So what we'll do is we'll take these blocks out, and then I'll tell Miss Corrina that we will have her back in a few days or in a week, depending on what's going on with her. And then we'll pick right up where we left off, and we'll continue to clear this. Now, once we've got this pelvis in category 2, we'll move on to category 1, correct that, and then we'll start doing the individual vertebra. And you can see that in a subsequent video. We'll get that out to you as soon as we can. But in the meantime, thank you so much for joining us today. Thank you all for joining the Psychetruth channel and being a part of our community. And we look forward to hearing from you. My web address is www.jeffechols.com if you have any questions or if you need any help. We'll look forward to seeing you in the next video. Bye-bye.